Good evening, everybody. Welcome to Breast Cancer Now's Facebook Live this Thursday evening. This evening, it's a question and answer session. I'm Catherine, one of the clinical nurse specialists at Breast Cancer Now, and I'm joined by my colleague Sonia, also a clinical nurse specialist at Breast Cancer Now. And we're going to be taking your questions on anything to do with breast cancer this evening. It is actually our last Facebook Live for a while. So the last one in October, we're nearly through to the end of October, which is Breast Cancer Awareness Month, as many of you will know. But obviously, breast cancer stays around all year round, and we breast cancer is around all year round, and we're certainly here throughout the year to continue to support you, even though Facebook Lives might not be around for just a little while until into 2026. So if you've got questions this evening, please do post them, and we'll have a look at those. If we don't manage to actually answer your questions this evening verbally, then we will drop you a note in the chat tomorrow and answer those for you. Do remember that this area is public, and so if you're going to ask a question, then everybody else will be able to see your question, and they'll also be able to obviously hear our answer, but also see the answer if we post you one tomorrow as well. So do be mindful of that. And obviously, as I said, we're still here the rest of the year, not just October, and we've got lots of ways for you to get in touch and continue to ask your questions. So our helpline will be open tomorrow. We're up Monday to Friday, 9 while 4 on 0808 800 6000. So you can speak to one of our nurses there, or you can drop us an email, or of course we're on social media just now, so you can drop us a message, private message or a public message if you like, to us to answer your questions, ask your questions, and we'll answer those for you as well. So what we thought we'd do is, we haven't had any questions in prior to this because we didn't actually put an ask out today, but there's been quite a lot of questions this month, hasn't there? Obviously, lots and lots of calls on the helpline and lots of written questions for us to answer. So we thought we'd just do a start by sort of going through a few of those common ones until people start to ask us questions. So what have you got for us, Sonia?
Thanks, Catherine. So we had a question come in. So Susan has said that she noticed a lump in her breast. Her breast is quite painful. She's 28 and she's wondering whether she should get this checked out for cancer.
Right, okay. So, yeah, I mean, if we spoke to somebody like that on the helpline, then we would obviously be making sure that taking a little bit of information from somebody, and somebody who is young, it's less likely to be an issue from a cancer point of view. There are lots of benign type, conditions in the breast that can happen, particularly when you're younger. But it's really important for people to get things checked out, isn't it? So even at 28, we would be encouraging her to go along to her GP. And what would happen if she went to see her GP? What possibly could happen, do you think?
Yeah, so it's like you said, Catherine, always important to get any new or persistent changes checked out, regardless of your age. And what your GP can do for you is they can clinically examine you. They can check the area of concern for you. And either what they can do is give you some advice, give you some reassurance, or they may say, well, let's refer you to a breast clinic. And if you are referred to a breast clinic, again, that doesn't automatically mean that it's something worrying or something sinister. Breast departments have the resources to be able to find out what's going on and can hopefully give you the reassurance that you're looking for, or talk through management with you with whatever the changes that you've noticed.
Yeah.
Um,
Yeah, and
we've got something.
at 28, we wouldn't expect somebody to have a mammogram, but there certainly is an ultrasound and, if necessary, a biopsy.
Yeah,
Most of the time, it's women over 40 that might have a mammogram, unless the team think it's going to be helpful. But
yeah,
we would all say to anybody, regardless of their age, that if you found a new lump, something new and something different, any change, there's lots of information on our website about what changes to check for, lots of what we call our TLC messaging, our touch luck check. So everybody needs to continue to be breast aware throughout the year, so please have a look at that.
absolutely.
Yeah,
Thanks, Catherine. I think we've got a question coming.
we have.
Tracy, so she says, I have been experiencing pain and pulling near a scar from a lumpectomy. It will be 2 years next month. That's not
Yeah, this is
happening. So
something that comes up quite a bit as well. In fact, I think I've talked to a couple of people this last week about this, and I think people forget that even though the scar on the outside has healed really well and probably quite quickly in most people, they do.
yeah,
Few people have major problems these days, and particularly with after a wide local excision, a lumpectomy, as we refer to it. But the scar tissue inside does build up. That healing continues to go on, and it can quite often take about a couple of years, 2 years or so, for things to settle down. If you've got some pain, then Tracy, it would be and pulling. Then it would be really helpful to check in with your treatment team, just so that they can check that out. Not because we think that there is anything worrying. It is actually quite common, and particularly when people have had a lumpectomy and they've had a radiotherapy on top of that.
yeah,
But maybe they could just help you go back to some of those stretching exercises.
yeah,
There is a good Facebook Live, in actual fact, I think, that not that long ago, about
yeah,
looking after scars and that type of thing. So, you could have a look on our YouTube channel, which is where all of our Facebook Live sessions are stored once we've done them. And if you want to ring and chat with one of our nurses as well on the helpline, Tracy, then you can do that as well. So, a couple more questions coming in here. So let's go with the live ones. Helen says, I had a lump removed and a total lymph node clearance 6 years ago. It says filled by chemo, but I think she means followed by chemo, radiotherapy, and she's on letrozole for 10 years. I get terrible pain in my arms still, and underarm and breast. Terrible heartburn as well. I thought it'd be back to normal after all my treatment, but I don't think I'll ever feel normal again. Are these problems normal? I think this sits right within your sort of area of expertise, Sonia,
yeah.
because you are our CNS for living beyond primary breast cancer, and managing side effects of treatment comes up all the time, doesn't it?
Absolutely, and sounds like a difficult time for you, Helen. So, thank you for writing in. Are these problems normal? So it could be that the heartburn that you're experiencing could be unrelated to the diagnosis and the treatment that you've had. So it may be worthwhile perhaps speaking to your GP about that. You may find that helpful. With the pain that you're still experiencing under your arm, and in your breast, I think, as Catherine had explained previously, it's not uncommon to have some degree of discomfort, especially where you've had surgery, and you've mentioned you've had radiotherapy as well. But you're never wasting your treatment team's time if you're still under their care to perhaps flag it with them, and they can assess it for you, or your GP can, and your GP can always refer you back to the breast team. It may be that you might benefit from physiotherapy. So again, that's a worthwhile discussion to have, or even a referral to a pain team, where you may not necessarily be given pain relief medication as such if you're hesitant to take medication, but they can always talk you through how to manage your pain. So that might be a worthwhile option to explore. Will you mentioned, so I don't think I'll ever feel normal again, and you're certainly not alone in feeling like that. And many women and men feel like that after they've had treatment for breast cancer, and it takes time, and you may not ever completely feel back to how you were prior to a diagnosis. I'm sure you would probably think the same, Catherine.
Yeah, definitely. I mean,
Yeah,
Helen asks, are these problems normal? They are very common. And yes, they are normal, but just because they're normal, Helen, doesn't mean to say that they don't need help and they don't need
yeah,
intervention. I suppose I would add that, having had a total lymph nodes clearance, then we know an awful lot of people have issues with their shoulder, with their arm, nerves underneath there. There's a lot of them, and they get sort of bruised, bashed, and damaged in the process of
yeah,
surgery. And if people have radiotherapy as well, and nerves notoriously don't heal particularly well or very fast if they're going to do that. So I think I would be certainly asking to go back to your team, see if you can get something from them, an appointment with them. You might have to go back to your GP and ask them to re-refer you, but try your breast care nurses first. They'll tell you what you need to do. Just get checked out, and then from a pain perspective, as Sonia says, there's quite a few things that people can offer and support in managing that and helping to make that improved, because you want to make sure that you as back to normal as possible. And I
yeah,
would also say, give us a ring on the helpline and chat this through. We've definitely got the time to be able to do that. We don't replace your team, but we
yeah.
do, have the time to be able to chat that through, Helen. So give us a call.
That's
Okay.
awesome.
We've got another question. So I'm a little bit confused, but I think Terry has clarified a little bit here. It says, she says, I've had a lumpectomy. I'm on letrozole, pain in the joints and lymphedema. So we know that pain in the joints whilst on letrozole is incredibly common.
Yeah.
The breast is still sore, and I feel fat. Doctors don't take it seriously. And she's added, I'm doing everything, swimming, can't run anymore, but the cancer's nurses from the lymphedema team have not, it sounds like the team are not there now, and they're not able to support her with the lymphedema as well. Oh, I hear you, Terry. I think this is a really difficult time, isn't it? You don't say how long ago it is that you had your treatment, but I think an awful lot of women do experience weight gain on their hormone treatment, and that's something that we need to pay an awful lot more attention to. You're right, in sometimes you don't get the support that you need via your hospital, so it might be really helpful for you to give us a call on the helpline and talk through a little bit more about what's been happening to you and sort of what support you've been able to get or not get on the helpline. But we're definitely here to help you. There's some information on our website about how to manage joint pain, which is that typical thing that a lot of people get with their letrozole. So joint and muscle pain, that would be helpful. A lot of people find stretching exercises can help that type of thing, as well as some regular simple pain relief as well. But if that's not helping, then it's definitely time to check in with a team or with us in the first instance, and we'll give you a little bit of help to be able to re-engage with your team and what to say and that sort of thing. And the same with sort of weight management as well. I think it would be helpful for you to have some support with that, and it might be that you need to check in with your GP about that and just ask about what you can do. Lots of people say the same things. They're doing lots of physical activity, and really are really struggling with that weight gain. So support in there to be able to do that, so you don't lose hope and you don't get down about it, is really important. So Terry, again, give us a call on the helpline, and we can chat that through and spend some time with you.
Yeah. So Chantel says, is it normal to bruise easily whilst on Zoladex and tamoxifen?
I haven't come across this a huge amount. Everybody, responds differently to medications. So Chantal, it's not something I would commonly say. Although Zoladex, for people that don't know it, is it's like an injection, and it's something that switches the ovaries off, so they're not producing estrogen. So it's a form of hormone therapy, and it's a quite a big needle and a sort of a pellet that goes in there. So it's not surprising that a lot of people bruise, but it seems to be that you're suggesting that your tamoxifen seems to be affecting that as well. So I think that's something to check in with your GP, or you don't say how long you've been on those things for, Chantel. If you're still under your treatment team, I would go back to them and just ask about that. But again, anybody this evening is welcome to give us a call on the helpline and chat that through, before they do contact their treatment team, just for a little bit of added support with doing that as well.
And Chantel, what might be helpful is asking your breast care nurse or your practice nurse, whoever does administer the injection, to perhaps alternate the sites. That can help, so that you're not just giving trauma to the same site every month. But yeah, I agree, Catherine. I think flag it with your team if you think that you are bruising a lot, and they can assess and investigate and see what's going on.
Yeah, hopefully they are sort of rotating those sites anyway. I think most sort of nurses try to do that and are expected to do that. But if that's not happening, then that's certainly a good point. But yeah, I think, Chantel, as we say, go back to your team or ask your GP about that. But if you're under your team still and you're still in contact with your breast care nurse, please do ask about that so they can check that out. Okay. Rachel says, how can I address my body image issues? I had a lumpectomy and lymph node removed 3 years ago, but I feel wonky. This is one that comes up all the time, isn't it?
It does, and I think it's so important to be able to be happy with how you look and how you feel about yourself and your body. And with breast treatment, especially with surgery, it does alter your body image and also your perception of how you look. And what I would certainly suggest, Rachel, is if you're perhaps unhappy with any asymmetry that you have, do speak to your breast care your nurse and your breast surgeon. Your breast care nurse can hopefully arrange a consultation with your breast surgeon, and what they can talk through with you is options for you, surgical options perhaps, to help symmetrize you so that you feel a bit more comfortable with how you look. And they can talk through options that you may be eligible for, and options that your hospital may be able to facilitate. It may be that if there are certain surgical options that they're not able to do, they can refer you elsewhere perhaps. But it is absolutely something that you should be able to speak to your team about.
Yeah.
If you have any thoughts on that, Catherine.
Yeah, well, I suppose, that's one practical and physical way of being able to sort of
Mm,
talk through that, isn't there? But there's the psychological issue of that as well. And I think, just being heard about how you feel about your body, Rachel, and that wonkiness that you feel is really important. So, we're certainly here to listen to those concerns, and signpost you maybe to other things that might help, just to take in
yeah.
a little bit more detail. There are lots of things, not just surgery, that make
No.
people, unhappy about their body image, and body image is that whole, not necessarily how you see yourself and how you
Yeah.
think other
Yeah.
people see you as well. So I think there's lots of facets to that as well. So it's quite a complex thing, but again,
Mm,
even though we're
mm,
saying a lot of people feel like this, then it doesn't mean to say that that support isn't there. So
mm,
some people will seek some type of talking therapy to be able to talk that through from a professional point of view. A lot of people actually find it really helpful to access our Someone Like Me service,
yeah.
although that's not professional support. It's a
Yeah.
trained volunteer support, but it can sometimes help to talk with other people who've had exactly the same sorts of feelings,
Yeah.
and just talk through what they did to help themselves. So there is, there's quite a lot to think about and unpick there, I think. Rachel, and yeah, we'd be really happy to talk that through with you on the helpline. So quite a few signposts that we can give you, I
Yeah.
think, when we've got a little bit more detail about what's been going on for you as well.
Yeah.
Okay,
Thanks.
I think we've got a question from Kelly there. Can you see that one?
Yes. Should we receive a full body scan after breast cancer diagnosis?
Okay, so that sounds to me as if that, Kelly, you're sort of recently diagnosed,
Mm,
maybe, or obviously you've had a diagnosis. First thing, after a diagnosis, you wouldn't necessarily expect everybody to have a scan of some description, and full body scan usually refers to CT scans. There might be instances when some people might have that, so if their cancer is particularly big, or it looks as if there's quite a lot of lymph nodes underneath the arm that have already got cancer in them. So, but from a guidance perspective, that wouldn't always be the case that everybody has a scan. And the same can be said for follow up as well. We
yeah.
get loads of questions about monitoring scans after a diagnosis and after treatment has finished as well.
Mm,
The problem with that is there isn't enough evidence to be able to tell us that that makes a difference. It's
yeah.
not due to money, although we understand at the moment, resource and capacity is difficult, but that decision isn't made on that sort of basis.
Yeah.
It is about whether people need that, and also balancing that type of thing with the amount of radiation that a thing like a CT scan does give
Yeah.
you. Actually, the best way that we can give people is to make sure that they remain breast and body aware after a
Yeah.
diagnosis,
Yeah.
because they are living with their body 365 days a year, and that scan will only tell you about one snapshot, 1 hour of one
Absolutely.
day, 1 month in 1 year. So at the moment there isn't any evidence to suggest we should change that. That's not to say that it won't change in the future,
Yeah.
but yeah, this sort of most of the evidence points towards the fact that that is not particularly useful, but actually
Yeah.
asking people to keep an eye on themselves. And there's some good information again on our website, and a booklet about follow up and that type of
Yeah.
thing after breast cancer. What now? I think
Yeah.
that talks about follow up and being breast and body aware, and
Yeah.
talks about why we don't have scans a little bit in there as
Yeah.
well. So you might find that helpful
And we've got
to be
some
able
really
to.
great infographics on things to look out for as well. So you might find that helpful. And one thing that I would say is that with your clinical teams, they will not hesitate to do the necessary investigations if there's a need to do it. So it is going back to what you're saying, Catherine, in that it's not just doing something for the sake of doing it, because you always have to weigh up the risks and benefits, and
Yeah.
and your team will help you do that, and they will guide you and they will talk you through what they think is appropriate for both your diagnosis and treatment and for the follow-up.
Yeah, but having a look at, and being breast and body aware after a breast
Yeah,
cancer diagnosis is another publication that's called Changes to be Aware of After Breast Cancer as well.
yeah,
So that is a real handy leaflet as to
yeah,
just to get to know. And yeah, we would empower and encourage anybody to. And it really is important for anybody that spots anything new and is persistent, it's different, doesn't have an obvious cause, to report that
yeah,
to their treatment team, to their GP. And when they're speaking to their GP, if that's the route they go down there, just reminding their GP, it might be a few
yeah,
years on
yeah,
since people have had their diagnosis and their
yeah,
treatment, and a new symptom that they're worried about, because we know that worry never goes really away for people. But just
mhm,
reminding their GP that they've had a breast cancer and they understand that new symptoms can be a sign of the breast
yeah,
cancer coming back, even though for most people that won't be the case. So,
yeah.
all right.
Okay.
Who else have we got
Sonia.
here? We've got quite a few in here, haven't we? And I want to make sure I've not missed one.
Um,
Is that Charmaine that's next
yeah,
there? Can you
Charmaine.
see that one?
Yeah, so Charmaine says she's had 24/7 bone pain now for 3 months. She's constantly tired, pain in her breast and armpit. 2 years NED, stage 3 triple negative. They won't test me, just keep saying it's side effects from treatment, and because and breast cancer doesn't cause pain.
Okay. Charmaine, it sounds like you've been talking maybe to your treatment team, but I'm not
Mm,
desperately sure about that. It might have been your GP, but I think probably, we've repeated quite a lot about going
yeah,
back and to teams, etc. But, if they're constantly saying that to you, maybe it'd be helpful just to give us a call so we can talk that through in a little bit more detail for you, and just give you some pointers about going
yeah,
back. And sometimes, some people do feel that they have that gut sort of instinct about things, and if they're getting nowhere, sometimes they end up getting a second opinion and going somewhere
yeah,
else, which is possible as well. So I would definitely say, Charmaine, please do give us a ring. You've got lots of things there that if they've not been checked out, and it doesn't sound as if they have been, then it sounds as if it would be worthy of reporting them, just so that they could be fully assessed. And obviously your doctors and nurses are in the best place to or doctors and nurses in a breast unit are best placed to make the decision as to what type of follow-up and what type of imaging or checks that you need. But yeah, give us a call and we can definitely talk that through with you and give you a little bit of support on that as well. Gillian is next, and she said, I had my lumpectomy with chest wall perforator flap reconstruction in June, and I finished radiotherapy, that's just jumped, in August, and I'm suffering with discomfort on the operation
mm,
side. Is this normal? It sounds as if you've had quite an operation there,
yeah,
Gillian. You don't specifically say what type of flap you've had, but a breast reconstruction using your own tissue is no small undertaking, and that was only in June, and you finished your radiotherapy in August. We're
yeah,
only in October, so both those things could still be giving you some discomfort. It takes quite some
absolutely.
time for things to heal, for things to settle down, and radiotherapy on top of that can also bring about some skin and some tissue
Yeah,
changes as well. So yeah,
absolutely.
again, really helpful to go back to your team. You don't say whether you've done that or not, but we're here to listen to that and to your concerns and talk that through with you
Yeah,
as well. But going back to your breast care nurse in the first instance would be really helpful for you to talk about your concerns, and hopefully she can give you some reassurance in the way that we have done, but also just make sure that there's nothing else that needs doing that is causing that pain and that discomfort for you that could be addressed, I would say as well.
thanks, Catherine. I've got a question from Laura. So she was diagnosed with ILC. I am on anastrozole for 5 years. From what I read, ILC, if it reoccurs, it's usually a later reoccurrence. So after the 5 years of anastrozole, I feel like I will be thrown back into the fire.
Okay, so just so that anybody who's listening doesn't know, ILC is
Invasive.
invasive lobular. Sorry, these questions keep jumping down the pile. Yeah, I think sometimes it's really difficult to say, isn't it, about prognosis and
Yeah,
where that risk is and how long that might be. I think for an awful lot of people, and not just those with invasive lobular cancer, particularly if it's hormone positive, which lobular cancer can tend to be, then we know that for some people there is this period of time, and it can be actually years down the line, when their breast cancer, if it's going to come back, does come back. And we've got to sort of stress that most people's breast cancer does not come back. It's treated successfully, and that they never have a problem again. Not that they don't have side effect problems. We've already discovered that there are some side effects, and that does affect quality of life, but the cancer itself doesn't come back. So I can understand that feeling after 5 years, once you've stopped taking that tablet, that feels like that safety net has been taken away. But actually we know that there is a carryover effect of taking that drug for 5 years. It's the taking it for 5 years that's the important bit, and that will carry over. But it sounds like it would be really helpful for you to talk through your sort of risk, and whether somebody has actually talked through the statistics of that with you, Laura. That's not something that we specifically can do, although shouldn't put you off from giving us a ring and talking that through with us. But your team can actually talk about the risks, and what your personal risk of your breast cancer coming back, and indeed as to whether there would be any reason for you to need to continue your anastrozole for a longer time, which some people do because they are at higher risk of their breast cancer coming back. The psychological and emotional impact of that, I think we can't underestimate as well, because that whole, I feel like I will be thrown back into the fire, and the worry about that is constant. Our speakers' lives, for those with primary breast cancer, if people want to look at those, I think, we quite often cover those type of subjects. And I think there might be one about worry and uncertainty coming up in there. So it'd be worth people checking in with that. That's not a replacement for checking in with your team or having a discussion with us. So please do all of those things, Laura. We're here to give you a bit more support in a bit more detail with you as well.
And there's also the moving forward course that might interest you, Laura. If you've completed your active treatment, it does talk through fear of recurrence and symptoms to be aware of. And it can be scary when you don't have that safety net, so to speak, of your breast team. But I think keep in mind, you can always go back to your GP, and they can always refer you to a breast team as and when needed. So that will never go away. You will always have some clinical support as and when needed. But do talk through your concerns with us on the helpline. Access the support, so the moving forward course, the speakers live that Catherine mentioned, and you can see if that will help, hopefully help address any concerns that you have at the moment.
Okay. The next one is from Joanna, and something that's coming up quite a bit for quite a few people, I think, is just sort of delays in starting treatment, sometimes in diagnosis, but in treatment as well. So how long do you have to normally wait to start chemotherapy after seeing the oncologist? I am assuming, Joanna, that you might have had some surgery. You might want to clarify that with us. It's already been 3 weeks. I've not received an appointment, and I've been waiting 48 hours for a breast care nurse or my oncologist secretary to call me back. Had a lumpectomy in July, and a re-excision in August for clear margins. I'm also HER2 positive, I think she means. I don't want to pester them too much, but started to get down about it. I can absolutely understand that, Joanna. I think, teams are really, really busy at the moment, and that resource and capacity problems are coming up, and this is having an impact on starting treatment. But don't let that stop you wanting to get in contact with them. I think it's really important from your point of view that you just give them a little bit of nudge and say, I need to know. Most people, there will be this sort of 31-day period from the decision to have that treatment, whatever treatment that is, whether that's surgery or other things. It's generally a sort of an expectation that type of time frame would come into play, but we also know that, as I say, with the resource and capacity issues, that there are a little bit longer wait for that type of thing. And of course it's important after surgery to make sure that everything is fully healed, you don't have an infection, and that you're getting, you're absolutely ready and fit enough to be able to start that treatment. But understandable. I think it would be helpful for you to do a little bit more pestering, as you put it, and just contact them if you've been waiting, and just saying, tomorrow's Friday. It's always Friday when people want to sort of call, but to do it first thing in the morning and just drop them a message, or give them a call and just say, I know I'm sort of ringing you again, but please can you tell me when I might expect to be able to do that. You sounds like you've had a discussion with the oncologist, and that chemotherapy and Herceptin or that type of therapy has been agreed since you're HER2 positive. So please do go back to them and ask them when to expect that, just so that you've got a bit more of a time frame. And again, Joanna, if you want to give us a call and talk through that, then you are more than welcome to do that. That would be absolutely fine. I don't know that there's anything else we can add to that, really.
No,
It's really difficult managing those situations, isn't it?
Yeah, you can also ask, what the reason for the delay is, if there is a delay, and that might help you to know that. But I agree with Catherine. I think, it's absolutely okay to contact your treatment team. They will understand that you are anxious about wanting to start as well. And hopefully they can give you a bit of an update as to when you will start your treatment.
Yeah. Okay. Next one from Anne. Can you see that one?
Yes, so hi, just diagnosed and chosen to go down the letrozole route rather than surgery, but feel so isolated. I'm sorry you feel like that, and I mean, I'm sure if you were given an option between uh, endocrine therapy, hormone therapy, or surgery, that hopefully your team should have explained the rationale for both. Sometimes hormone therapy is given as the first line of treatment if it's unsafe for you to have surgery for any reason, or sometimes they may just want to downsize the breast cancer that you have. To then hopefully plan for surgery at a later date. Um, you don't say why you feel isolated, but that's something perhaps that you would like to talk through with us on our hotline, and we can explore that a bit with you further. I think Catherine mentioned a few services, someone like me service, where we could pair you up with somebody who is taking letrozole, and who did take it as first line of treatment, and that might help you. Um, I don't know if there's anything to add to that.
Yeah, I mean, I think it's really hard, isn't it, when
Yeah,
you're feeling isolated, that you need that support around you, and
yeah,
sometimes you need that social support and time away from cancer stuff. So it's about
yes,
thinking about what you need for yourself and accessing things locally. But an awful lot of the time, when you're feeling isolated because you've got a diagnosis or you're starting treatment, then it's because you're not with people who understand and can get
yeah,
it. And I think that's the beauty of the Someone Like Me service that we have. We have trained volunteers, and many of them that have gone through many different sorts of things between them. So it's really helpful to be able to talk through with them, so you feel a little bit less isolated. You've certainly got them on your side, to talk to, usually on the phone. Some people do it by email, but most people do that on the phone, and we can arrange for a volunteer. May not be that we can match somebody, or the team can match somebody absolutely exactly, but most of the time we can find a volunteer that is able to listen and support, give some support, share their experience, so that you don't feel alone. But I think, again, I would say, Anne, that it would be really helpful for you to give us a call, and we can spend some time talking through that, and just, not only Someone Like Me, but anything else that comes to mind, depending on your situation, that might be helpful for you as well.
And if you feel comfortable to do so, if you haven't already spoken to your team about how you're feeling, because they can also support you and talk you through what support they can offer. Your GP also can talk you through local services that you could access, and you may find that helpful. But we can always, have that conversation on the phone with you as well.
Yeah, and that's actually a really good point, because I think an awful lot of the time, and when people have had surgery and then they go on to other treatment, radiotherapy, chemotherapy, as much as that is a really big undertaking, what they do have through that is access to people who are giving that treatment, or they're seeing them in clinic. And so, you quite often, when people have chosen, or actually it's not an option for them to have surgery, then they take their tablets away, and they don't really get a great deal of follow-up. They do get follow-up, because that letrozole will take longer to have an effect on the breast cancer for it to start and shrink down a lot of the time. Sometimes actually it's much quicker than you think it's going to be, but it does mean that those appointments are spaced out, so there's less time. So if you haven't got the name of a breast care nurse, Anne, it would be a good idea to sort of see if you can contact the hospital and get one, and just check in with that breast care nurse and ask questions about what's available. You might find that there's a local support group there that you can access, as Sonia said, there are usually things around and about for you to be able to access, and if they've not already told you that, then it'd be helpful to know. And the other place that I often direct people to locally is their cancer information centre. So most hospitals have got one. It might be bigger, it might be smaller, but there's some wonderful people out there in the cancer information centres that can tell you about groups, about other things that are going on. Quite often they have complementary therapies that are going on in the cancer centre. So there should be quite a few things for you to tap into, but it sounds like it'd be great to have a discussion with you, Anne. So do give us a call on the helpline. So I'll just repeat the number again, since we sent the helpline for so many times and everybody's answers, I think. So it's 0808 800 6000. Okay.
Thanks.
So next one is
Elizabeth.
Amanda.
Oh, you've got Amanda.
Oh, sorry, Elizabeth. I
Elizabeth.
do beg your pardon. We'll come on
That's
to
okay.
Amanda, but Elizabeth, as I said, they keep hopping up and down to the questions.
Elizabeth had a mastectomy over 2 years ago, no reconstructive surgery. She's having pins and needles in her right arm and discomfort under my arm. Is this normal? So you don't mention if you've had any surgery to the axilla, Elizabeth, and you also don't mention which side you've had the mastectomy. I mean, if it's the right side and you have had perhaps any surgery to the underarm, it's certainly not uncommon. I think we've touched upon this, haven't we, Catherine, throughout this evening's session about, having discomfort, certainly sort of around that area, because it can interfere with the nerves, you can develop scar tissue. I think if it's new or if it's persistent, it's always a good idea to flag it with your team. They can assess it for you and they can hopefully advise as to what is causing it, and then talk you through the management. But I think it's difficult to comment if it's your arm and you haven't mentioned if you've had surgery. What do you think, Catherine?
Yeah, I mean, I think it sounds as if it was probably the same side as the mastectomy. And if that's the case, then, like you say, most people with a mastectomy will have had some sort of input or some sort of lymph node type surgery, however big or small that is. So, that sort of hole coming back to life with the nerves, etc., is not an unusual thing, even this far out. However, I think anything that is new and different, and as we've said, and can't be obviously explained, even though we've given you a possible explanation to that, we'd encourage anybody to sort of report that to their treatment team. And it's 2 years ago, I think you said, yes, Elizabeth, that you had your mastectomy, so you should still theoretically be under that treatment team. You'll still be having follow-up, you'll still be having a mammogram on your other breast, obviously nothing on the side where you're flat, but you'll be having a mammogram on that side, and just to report those new symptoms so that can be checked out would be really helpful for you. And if there's no obvious cause apart from the side effects of the surgery that you've had, and maybe even some radiotherapy, you didn't say that, but some women who have a mastectomy do still go on to have radiotherapy, then that might be the cause. But I think it's important that that's checked out before you get some advice on to how best to manage that, and whether that's pain teams, physio, that type of thing that might help. Nerve pain is really difficult to sort of manage, so often pain teams are brought in to do that, and they use particular treatments, not necessarily your normal painkillers, to be able to do that. But it would be helpful, because we want to make sure that people have a good quality of life after their surgery. And lots of people have mentioned things, whether that's body image, symptoms, pain. It's important that we get on top of those for you to be able to get on, enjoy living and enjoying the things that you like doing as well. So you can give us a call as well, but it sounds like it would be a really good idea to drop this by your team and give your breast care nurse or your treatment team a call, Elizabeth. Amanda says, I finished active treatment in March 2023, so a couple of years ago, 2.5 years ago, I guess. No, is that right? Yes. But I've still got terrible health anxiety. Please assure me that goes away. Amanda, I think you are one of many people that call us and have that anxiety. Some people have had health anxiety before breast cancer came into their lives, and that's really hard too. It depends on how you were managing that before as to how you manage it now. Again, I think input for that, there are quite a few signposts for that, and certainly sort of talking therapies, cognitive behavioural therapy, there are all manner of talking therapies that can sometimes help people manage that. It's not necessarily something that will make that go away. I think if you leave it on its own, Amanda, without any input from people, then it's not going to go away. It won't suddenly go away. This is about thinking what you need, talking through with somebody about that health anxiety. I was going to say the root of that anxiety, clearly breast cancer is one of those, and the worry about the future, but there are other things that can feed into that. So I think it's really important that you get some professional help with that. There are places like Anxiety UK that have got really good resources, and they've got a helpline as well that can help people, and they've got specific information on health anxiety. As I say, many people suffer from that. They may not have had a diagnosis of cancer or breast cancer, but I think we can help people out with that. So again, if the first thing that you do is call us on the helpline, then that's one step towards getting some input for this, Amanda. I suppose the other thing to say is, we did say about dropping us a line if people really are a bit afraid of picking up the phone because it's quite a big undertaking. Then we've got our Ask Our Nurses written inquiry service that's on the website, and you can ask us a private question through that. So if you put in Ask Our Nurses, I think it'll come up as Talk to Our Nurses, but within that there's the Ask Our Nurses service. You can email us through that web submission form, and we will write we can write you an answer, or it gives you the option, I think, to be able to give your phone number, and one of the nurses will try and give you a call and talk through that. So if you need us to make the first move, then you can also do that as well.
And if it's helpful in any way, I think you mentioned about please tell me this won't. Please assure me that this goes away. What might be helpful is speaking to your treatment team about your individual risk, because it does vary for everybody. And so understanding what your risk is may help you. But I think it's one of many suggestions. Catherine has you had some really good suggestions, and sometimes it's trial and error, figuring out what works for you, and then going with that. But I think the first step in reaching out for help is always the most difficult. But there are lots of people out there to help support you through this.
And I've mentioned professional support, but I've also mentioned for previous people, someone like me, that volunteer support, that person that really does understand where you are and what it's like to wear the shoes you're wearing at the moment. I think that would be a good start. If you can give us a call, Amanda, then please do. We also have a voicemail facility on the helpline. So again, if you just want to leave us a voicemail message, knowing that we're not going to pick up the phone tonight, we won't be there because we're here on a 9 till 4 Monday to Friday and 9 till 1 on a Saturday. But then one of our nurses will call you back as well, and hopefully we'll catch you to have that conversation and start that road to sort of getting some support around that health anxiety. Okay. Debbie says, why is there no clinical evidence for CT scan annually? Finished treatment end of March. So we sort of touched on this earlier on, but we haven't. I think studies in the past, Debbie, have actually looked at the difference between doing annual scans to see whether they actually are very helpful and fruitful at picking up cancer, that might have spread elsewhere. Obviously, we do annual mammograms and that sort of thing from a monitoring process, and if there was anything seen in that would be picked up. But it's scientific evidence that is there that really doesn't prove that it makes a big difference to overall outcomes of people, and that actually most breast cancers that have spread or that have recurred, even if it isn't to elsewhere in the body, but they've been picked up in the breast, say, or the local area, most of those are found by people themselves. So it might change, as I say, and it's not that long ago since I sort of heard somebody speak on this, but the evidence really didn't stack up that a CT scan every year for everybody was going to make that difference. I know it's really difficult to sort of manage, and again, if you want to chat that through with one of us, Debbie, you're more than welcome to do that. But sometimes it's sort of just talking that through in a little bit more detail, and just thinking about what you can do for yourself and what other things there are to help you manage that if you're worried about that, which understandably many people are.
And I think there's a fine line, isn't there, between over-treating and managing somebody's risk and what their follow-up looks like. And CT scans are very sensitive, and they can pick up anything and everything. And given one's history of having breast cancer, your treatment team will have low thresholds. And so if things are picked up on the CT scan, they will then be investigated. And that can cause a great deal of anxiety and worry and concern when it could turn out to be absolutely nothing. And so it's like you said, Catherine, most of the time, if things are uh, picked up, it's usually by the individual where they've noted changes in their body. But always important to be breast aware, have your yearly surveillance, whatever that looks like for you, whether it's a mammogram or another type of imaging, and flag things up with your team. Because, yeah, wherever clinically indicated, they will always do the necessary investigations for you.
Yeah. So most people will have a mammogram, won't they, as their
Yeah,
annual imaging. I think very few people will routinely need that. There might be some instances, and certainly, we get calls from people with lobular breast cancer who are worried about that, because sometimes lobular breast cancer in the first place doesn't show up with mammograms. So
yeah,
that's very much a case by case and
yeah,
individual basis from that point of view. But it is talking through with your team. But for now, and it's pretty much the same sort of thing, across all of the breast teams,
yeah.
pretty much across the globe, I think, rather than, unless you're in sort of private treatment, that
Mhm.
are able to do that. And again, it's still a discussion about the pros and cons of doing that, and not over treating, or at least not over what we call irradiating people, giving too much
Yeah,
radiation as well, because that in
yeah,
itself can be problematic. And we know that there is a risk of people developing other cancers when they've had lots of radiation. So there's lots and lots to consider there, Deb.
yeah, yeah.
Okay.
Thanks, Catherine.
Do you want to read the next
Yeah.
one out?
Yeah, so this Lorraine is 54 and she has a lot of liver/age spots. She's currently going through weekly chemotherapy and immunotherapy. The spots are pink and itchy. She was told by her team to pop a little hydrocortisone cream on. Every other organ is scanned for secondary. I find it weird these spots aren't checked more meticulously. Yeah,
First time on, so apologies if we discussed
yeah,
previously. I don't remember this question coming up, so thank you for raising it, Lorraine. It sounds to me as if if you've got primary breast cancer, then you're having that immunotherapy, and we know that immunotherapy itself. I don't know whether these spots were pink and itchy before you started the chemotherapy and the immunotherapy, but what I do know is when we've added immunotherapy into treatment for people, which is a relatively new thing in breast cancer, that there are many side effects, and one of those can be to affect the skin. So you do get dermatological changes, skin changes with that immunotherapy. Your team will be pretty well versed at the side effects of those, and generally, if we know that things like, if you're worried about the fact that it might be cancer in the skin, that generally looks quite different. If it's not responding to the treatment that you're given, then I think that obviously your team would follow that type of thing up. But it's incredibly common to get the immunotherapy almost switches on your own immune system to be able to recognize the cancer cells that you've got within the body, but it switches it on, and sometimes it's a bit in overdrive, so it starts to recognize your own healthy cells as something that it needs to attack. You may well have got yourself been given an alert card to sort of look for lots of side effects there, Lorraine, and that's the reason for that. And quite a lot of those side effects can sometimes continue or appear quite some time after your immunotherapy is finished as well. So if you are worried about that, then do talk to your oncologist about it. I'm sure that they will give you some rationale. If they don't give you the rationale, I think Sonia's already mentioned this, it's really important to ask, why are you not worried about it? Why are you giving me this? Why are you not interested in sort of checking these out more meticulously as you've written there? Because it can help you understand, rather than just somebody saying, nope, don't need to do that. It's the understanding why that really helps people sort of settle and feel as if they're included in that conversation and that they're heard. And hopefully they can give you a not dissimilar answer to me. But obviously I can't see what's going on there for you. But don't stop, asking them. Please do ask them about that, because it sounds as if you're sort of worried about that, Lorraine, and the fact that, there are lots of other things that are scanned to be checked out when you've got symptoms. It sounds to me as if these probably are related to your immunotherapy, but I could be wrong. But do ask your team again.
yeah, yeah. No problem.
So Right. Well, we filled 50 minutes with loads of questions. Thank you, everybody, for all of
No,
those
thank you.
questions. We did have some sort of to talk through from an October point of view, but you filled the time absolutely brilliantly. At the beginning of the session, we did say that this is the last one of these for 2025, and that just gives a little bit of time and space to sort of regroup ourselves. We've got some new staff, to sort of to work with, and just rethinking about how we can make this even better for you in 2026 with the topics that we discussed. We hope to return pretty soon in 2026 in January with the question and answer sessions. And some of the other topic sessions as well. Please don't forget that we've got lots of services. We've said the helpline over and over again, haven't we? And do you want to sort of just go briefly through at least some of the primary breast cancer services that we've got, so people know that are there, that they can access? We said someone
Yeah.
like me multiple
Someone
times
yeah.
already.
So hopefully people are aware of that one. So for women under the age of 45, we've got our Younger Women Together service, and that's both online and in person. And so we do face-to-face events, usually 2 day or 1 day events across the UK. And so if you would like to meet with other women of a similar age who've had a primary breast cancer diagnosis, you're welcome to register for that. We also have the online equivalent, and so again you can register online, and it does talk through topics that are quite pertinent for women of a younger age, and so it does cover fertility, it does cover side effects of treatment, body image, many topics to explore. So that's definitely something to consider. And if interested in the face-to-face and perhaps were worried about how to get to the courses, we have what we call our access fund, and so we could financially support you in getting to these events. So again, you're welcome to call us on the helpline to talk through that through with you. We've got someone, the Speaker Live, so I think Catherine touched upon that. Speaker Live
And I've
sessions,
actually been looking to refresh my memory because
online.
it all went. But actually,
Yeah.
from the questions that people have given us this evening, we've got some really key ones coming up. So we've got one on
Yeah.
managing menopausal symptoms with
Wonderful.
Dr. Alison Macbeth, brilliant speaker. So that's on the 12th of November. You can have a look at these on our website. We'll pop some links on about the services. We've got Ted Bradshaw on the 18th of November, and he's talking about anxiety after breast cancer. So lots of people talking about anxiety today. We've got one about body image as well with Dr. Sarah Swan, and that's on the 25th of November. So that might be helpful to a few people that have mentioned that. And obviously, if you keep looking at that page and if you register for that, I think you probably get updates from us to say what's coming up. So you can pick and choose what it is that's relevant to you at that time, and tune into those. Even if you don't want to talk to other people, just that information might help people sort of and give them some support and guide them as to where else to go as well.
Yeah, and if you can't ever join in live when it's scheduled, the recordings will always be sent out to you, so you could always watch it retrospectively. So just keep that in mind. So yeah, definitely keep an eye on the Speaker Live sessions that we've got coming up. We've got the Moving Forward, I think I touched upon as well. So for people who've completed their active treatment, so their hospital-based treatment. So you're welcome to register for the Moving Forward. Again, there are both in-person and online sessions, and it's generally over a 2-week period, which covers topics which are quite important for those who have completed their treatment. And so it does talk through, I think I mentioned, signs and symptoms of a recurrence, both locally, so within sort of the breast chest area, and in the body, so secondary signs and symptoms to be aware of. It does talk through body image, talks through how to manage side effects. So a lot of people find that helpful to join. And if you're a couple of years out, you can still join. So if you're unsure as to whether you can, give us a call and we can talk that through with you. So I think those are the main ones for primary. I don't know if you wanted to talk through any services for secondary, Catherine.
Absolutely, yeah. So you started with the younger women. We've got younger women with secondaries together, so that's online and in person. We've just been in Leeds for a couple of days. We had a great bunch of women there, all under 45, and it just gives people the opportunity to talk to others, but also get those sort of that information via breakout sessions, etc. So our next 2-day event is in the spring, and that will be in Bristol. So if you're interested in that, you can just show some interest by calling us, and we can put you through to services for them to be able to know about that. But we do have an online 3-week event coming up, so that starts next Tuesday. So first couple of Tuesdays, 4th and the 11th, I think we have a break, because we do actually have a monthly online Younger Women with Secondaries Together support service as well. And then the 3rd week of that 3 will be in the 4th week. That sounds really complicated, doesn't it? But it will make sense. So if people want to register for that, then they can do. That doesn't stop you coming along to the face-to-face, because they are quite different. And of course, for anybody of any age, then we have our Living with Secondary Breast Cancer services. So again, they're online, they're in person. And I think the last count, we had something like 57 in-person monthly groups for those with secondary breast cancer or diagnosis of secondary breast cancer. All of our services for secondary breast cancer are facilitated by a counsellor, a therapist, somebody with those types of skills. Not because they will direct the conversation that that happens there, but they will facilitate and support that conversation. So that's open, and we also have now 7, I think, online group sessions. Meetings per month, one of those in the evening, and the rest are spread throughout the week at different times of the day and different days as well. We've also got our chat group, which happens a couple of times a month. I think during the day, that's been quite quiet, but the evening one, which is I think in the 3rd or the 4th week of the month, then that's quite busy. And again, there's been a therapist there as well, so you're always supported by somebody from breast cancer now there as well. And the speakers live, I've just had a quick look at those as well. So we've got something which is caring for someone close to you whilst living with secondary breast cancer. So an awful lot of people still have caring responsibilities despite the fact they've got a diagnosis of secondary breast cancer, so that might be helpful to some people. We've got one nearer to Christmas that is managing the festive season whilst living with secondary breast cancer. That's with Ali May, one of our lovely therapists from our Living with Secondary Breast Cancer service. And then just in that 2nd week of December as well, we've got some cozy yoga with Yvonne Whitehouse. Yvonne does some stuff with Make Seconds Count, who are another sort of great support for those people with secondary breast cancer. And so it'd be nice to sort of just have if you want to cozy and sort of think about doing a little bit of light yoga and feeling cozy on that day, then you can do that. Lots of things, we'll fill those pages up in the weeks to come. There will be different things, so keep looking. But for now, we've now nearly filled an hour with all of our chatting and our answering questions. If there's more questions we haven't answered that are sitting there, then we'll answer those tomorrow in writing. But I think for now, I need to shut up. I need to let us all go. I do want to say thank you to everybody that has watched these. It sounds like I'm saying goodbye forever. That's not true. We will see you all in 2026. I hope every single one of you. But I do want to say thank you to the team, everybody that sort of puts these together. We have some brilliant people working and who have worked for breast cancer now, who have been absolutely brilliant at putting these things together, and they've made it the success that it is. So thank you to everybody, technical, nursing and otherwise, have done that. And we will wish you an incredibly good night, and we hope to see every single one of you back in 2026. And I'll see you tomorrow, Sonia.
Yeah.
So good night, everybody. Stay well, and keep in touch. Remember the helpline's there for you.
Yeah.